I bring greetings to the people of Earth from Silicon Valley. I'm your ambassador. So I've been based there since 1983, working with technology companies to help them design products, hardware, software, services to meet the needs of cities in various ways, particularly around urban systems, which in Silicon Valley talk is the simple stuff of electric and gas, water, waste streams, building systems, mobility systems. So think infrastructure, think the fundamentals of what makes a city metabolic systems function or not function, as many of the cases are. So I'm here on behalf of an organization, Meeting of the Minds, which I was involved with the founding of this organization in the early 90s when it was a glimmer of an idea in Al Gore and Bill Clinton's head when they arrived down the street on Pennsylvania Avenue in the January 93. And it was parked inside World Bank headquarters, the office of the president, for about six and a half years, incubated there. And then we spun it off and relocated it to Silicon Valley. And it is a hybrid organization insofar as it's not just a think tank, it's not just a think and do tank, but it's an active partner. So it's sponsored by corporates, technology and non-technology, by government, local and national, as well as intergovernmental agencies like the World Bank, and by grant-making foundations and universities. So some of those organizations you'll know well, like Robert Wood Johnson Foundation, the Federal Reserve Bank, JP Morgan Chase, Microsoft, Deloitte, Cisco, Verizon, AT&T, Comcast, but then others that you didn't know existed, like the Volvo Research and Education Foundation. So we engage in real projects in the real world and not just publish about or talk about. And I'm going to describe one of those projects to you today as an illustration of the points that I'm hoping to be able to leave you with regarding the effective types of public-private partnerships that can mobilize the power of technology, and particularly digital technology, and particularly the data that flows through digital technology to enable urban health outcomes that are better and smarter than if we didn't have the digital enabled data. So with that as the prelude, I'll tell you about a project that we've helped to form called Urbanova, which is based in the city of Spokane, Washington. Those not in the United States, it's sometimes called the second city of the state of Washington, spelled like Spokane. And it's an economically distressed city which suffers greatly from the health effects of being in the line of fire for fire. And we'll talk about the air quality problems and crises that afflict Spokane. So Urbanova is a nonprofit organization established by a consortium that we organized for the local partners to help them solve some of their urban health and community development challenges using the power of data and digital technology, particularly with an eye toward urban health. And this is one of those public-private partnerships, many of which we've helped to form. I'm on the board of this organization, and I'll be there Monday and Tuesday next week to try and help push them up to their next stage of development. And these were some of the partners that we asked to contribute, and one of them is not listed, that's Verizon. So Verizon, for those not in the United States, is the largest, depending on how you count, telecom in the U.S. 150 million cellular subscribers. So the idea was public sector, like Meeting of the Minds, public sector, the city government, private sector, the largest utility in the northwestern part of the United States, Avista, a multi-billion-dollar company, plus Itron, a multi-billion-dollar technology company. University, academia, NGO represented there, because Washington State University in Spokane has both the School of Nursing and the School of Medicine, as well as the School of Engineering, and all three of them are involved in this project that I'm about to tell you about. And McKinstry is a private company that does things like urban design, smart green buildings. So the crisis that helped catapult this organization from a great idea that had bones to a real living, breathing resource was the crisis during August 2017, which was a public health catastrophe for the city. And because, air quality, as we've heard from many of the speakers, is kind of low-hanging fruit when you're looking at urban health challenges because it's so obviously connected to the disease prevention challenge. Although in the United States, unfortunately, a lot of local authorities don't really have a way of effectively yet connecting the air quality concerns they have with their health programs, particularly public health programs, or for that matter, private healthcare providers. So we decided this would be a great place to start this organization, but not have it be the only focus. And the first step, of course, in all of this, because as we say in Silicon Valley, if you can't measure it, you can't manage it, is to start better measuring, because our goal was manage and reduce the health outcomes, as in negative health outcomes of bad air days. We couldn't actually change the forest fire conditions, so maybe we could change more than just the monitoring locally and the early warning system locally. And all of these slides, you'll get a chance to look at these eye charts and see what actually these graphs are telling you. I don't really have time for that because I want to be able to get to the meat of it. But the idea was take complex data that's collected from distributed endpoints, namely the sensors that are connected by the wired and wireless network in the city, which is not city-owned, and I'll come back to that, and enable the visualization of complex data, namely where are the hotspots, where are the PM counts getting dangerous, when is that happening, and what kinds of responses in that particular part of the greater Spokane area are needed, whether you're an employer worried about worker productivity and worker health, or a school worried about absentee, or any other actor in the city, because there are many actors with many different concerns, not just the public health department or the emergency department of a public hospital. So we decided that really, if we wanted to get serious about health in the air and we wanted to do something that was truly controllable, because the forest fires in British Columbia or Alberta or the state of Washington or Oregon or California or Idaho were really not within our span of control, maybe we should also focus on air quality impacts from transportation. And so the idea was, first phase, do a prototype with the air quality sensors, which was relatively easy, and then move on to urban mobility and traffic and reducing the total pollutants from vehicular activity in the city. And to build a pretty sophisticated front end for the graphical user interface to see the data insights when they're delivered to the end user, whether it's a person figuring out, do I bike or walk to work, or do I avoid being outside, or whatever, an employer that wants to send an alert to employees about their best choices, or the back end, which is obviously in the cloud, where all this data is being collected and stored and secured, but also analyzed, because as we've heard from previous speakers today, it's not enough to have good data, and it's not enough to have good data sitting in the cloud. It needs to be analyzed so little insights can be generated from the big data that then become actionable. So the idea, of course, about actionable is it has to be real time, because historical data is interesting for academics and policymakers and wonks like us, but it's not necessarily great for the bus driver or the bus passenger to know anything except real-time information. That's harder to do, and you can see we have a pretty sophisticated rollout program where we know exactly what our reference sites are, where our air quality monitors and sensors are, where we plan to roll out additional whether it's additional air quality sensors or cameras. And this was the very beginning of that pilot. Now we're well past these numbers. But it takes time, because this is the nature of public-private partnerships. Who owns the street pole? Who owns the street light? Who owns the wireless network? Who owns the wired network? Who owns the data center? Who has the ability to do the engineering analysis, as in data science, to get the interesting real-time outcomes that can be actionable? So that's why the public-private partnership is important. That's also why it's a complicated beast that involves a lot of negotiations and give and take. And that is where I want to really suggest a few immediate takeaways. First, they're hard, but like marriages, they can work. Public-private partnerships, do end in divorce sometimes, like marriages do, but some of them are long-living and happy. This happens to be a particularly happy one and probably will be very long-living. It's not necessarily easy to raise money because it's not a for-profit, it's not a non-profit, it's not a government effort. And so philanthropies are sometimes having a difficult time figuring out, do I give to the 501c3 or do I create a special instrument that is a hybrid? This has been something that we've gone through with a couple of philanthropic entities. So that's one challenge. The other challenge is different stakeholders have different ways of measuring success. If I'm David Condon, the mayor of the city, or a member of the city council, it's not the same metric of success for me as if I'm a university doing academic research and getting published for it, or if I'm the public health department, which is trying to stretch my dollar farther at the county level, because the county is the one that owns the public health department. So that's one of the realities, is different stakeholders bring different types of metrics for different ways of success, and we need to figure out how to converge these. The other big takeaway is that when you're doing the kind of thing we're talking about, which is melding the digital reality with the physical reality and bringing those two worlds together, there are different laws. There's the laws of natural physical physics, and then there's the laws of digital. For instance, in the laws of digital, all information wants to be free. That's hard when you're a business. So I worked at Cisco headquarters for 7.5, almost 8 years before recently retiring. And, the reality we dealt with every day, the day I left, it's true now and it's true then, was the price of connectivity is going towards zero. The price of data storage is going towards zero. The price of compute is going towards zero. Not a very good thing if you're running a business that's providing connectivity, compute, and storage. But it's great for the rest of us who are not running those businesses, and we're going to take advantage of that. So that's the beautiful news. The good news for all of us who are not running tech companies is they need us to figure out new business models because they're struggling, even though, of course, it looks like they're all super profitable, Facebooks and Googles and Apples and Microsofts. Most are struggling to try to figure out what's the new business model in a world where a silicon chip or a sensor is moving toward pennies. And it may never be free, because silicon still costs something to make and engineer and design and so forth, but it's getting close. And that means opportunities for us who are trying to stretch every dollar for the health outcomes that we're hoping to achieve in our public-private partnership. So a couple of principles from the experience that we've had. Take a look at our blog site and you'll see us report not just about Urbanova and Spokane, but a whole bunch of other interesting experiments around the world. Thank you.